talk to you about your pelvic floor exercises. So in this short video, I'm just going to explain exactly how to do a Kegel, because there can be quite a bit of confusion about how to work those muscles. Quite often people get breath the wrong way round. But the breath is really important when you're doing your pelvic floor exercises, because you want the pelvic floor to work with your diaphragm. So when we're doing the pelvic floor exercises, we actually squeeze on our out breath, which a lot of people find quite hard to begin with. But the purpose behind this is because the diaphragm, as you exhale, will move up in your body. So you want the pelvic floor and the diaphragm to move gently together. Because if we do it the opposite way round, what happens is the diaphragm is coming down as you're breathing in and squeezing the pelvic floor. So it does take a little bit of practice, but obviously repeating and repeating, you will eventually nail it. Sometimes it can take a little bit longer than others, but it's obviously something to remember. It's an exhale because you want to follow that diaphragm up. So when we're talking about our pelvic floor muscles, all this red and blue area here is your muscles and your connective tissue of the pelvic floor. So as you can see, you've got your coccyx all the way back here, and it's coming all the way to the pubis here. So it's basically like a hammock of muscles here. And the way I can explain it is a bit like a trampoline. So as you're putting pressure on those muscles, they go down and then they should spring back up. So obviously when your muscles are loaded a lot, like carrying a baby for instance, that's going to put pressure on those tissues. So we really need to work with those muscles to help them become quite strong. So as we're working our pelvic floor muscles, I want you to imagine, and never actually do this, to connect the front muscles is as if you're holding a wee. So if you needed to go for a wee and you're just holding onto those muscles, again, you don't want to do that and keep holding wee, because that will actually cause you a bladder infection if you're not careful. But it's just a visual for you to be able to squeeze those muscles at the front. Okay, so because the tissues come all the way to the back, we actually want to squeeze the muscles at the back as well. So this is a bit like if you needed to pass wind, you'd suddenly find those muscles. So again, you're squeezing those muscles. And what we want to do is squeeze the muscles from the front and the back and squeeze them towards each other. So we're literally squeezing the muscles in towards each other and then up. So the motion is in and up. It is quite a lot to take in. Another way to be able to visualize is just imagine that you're trying to hold a tampon in. So it's all that squeezing in together and then up. So you don't want to over tighten the glutes, but again, it is sort of trying to remember, if you need to pass wind or if you need a wee, it's those muscles that you're gently squeezing in together and all the way up. And we do this again with the breath. So it's with the exhale, I want you to squeeze those muscles gently in and up. And as you inhale, you relax them down. So it's exhale, squeeze and up, inhale, release. So just practicing those as often as you can. You don't want to overdo it because you don't want to over tighten the muscles either, so you only have to do it for a short amount of time, just to be able to get that feeling of working with your diaphragm, working your breath, working your whole core together to be able to protect that pelvic floor. I hope that's helpful.